Good afternoon, everybody. Good afternoon. Welcome to CareSouth Community Live Podcast. I'm your co-host today, Daniel Myers. I'm the director for MATSUD here at CareSouth. And today, my partner in crime, Mr. Marek Calhoun, is in transit. So as soon as he get to where he's supposed to get, he's going to join us on his live. But today we have the big guy in the house. We got Dr. Stephen Smith. Glad to have him. He's the chief medical officer here at CareSouth. An awesome guy. I got it out, and just think so highly of. He's the man, y'all. He is the man. So you guys are. Look at that. There you go, Dr. Smith.
There's Marek. There's Marek.
Yeah. So this is the man right here. So all things medical, all things medicine. This is our guy to go to. And so today he's going to talk to you about the vaccine. He's going to talk to you about his experience. I got his permission to say this. So he actually had COVID-19 and he went through the process. And so he's going to give us a run through on how he felt, what went on with him, and then what's the best course of action when it comes to prevention and when it comes to dealing with this situation. Dr. Smith, you think you can handle that for us?
I'll give a try.
All right, I know you will. So, Marek, do you want to say anything before we go to let Dr. Smith step in, or?
No. I apologize for being a little tardy onto the podcast. I was out visiting staff, visiting sites. So I'm here.
Yeah.
In here. I'm looking forward to listening to Dr. Smith and his battle with COVID and recovery. When some don't know, I've had it as well. So I know where he's coming from. So I'm definitely want to hear his stories and more information on the vaccine from his perspective.
That's right. So without further ado, Dr. Smith, we'll turn it over to you. You introduce yourself and let everybody know what's going on.
All right.
I am Steve Smith. I do not consider myself a polished public speaker by any means. Not nearly as good as this as Daniel or Marek. But we will. This is, in fact, I don't normally do this type of thing anymore. I am glad to be out of it because in my old position, I was a director, but I actually wanted to do this one because that's how important the vaccine is to me. I was willing to get out of my comfort zone. Having said that, how I got it, what it seems to have happened, I went hiking with my son, and we went Blue Ridge Parkway. Was in the car together for some hours. Went on a beautiful hike, vigorous hike by my standards. And then Monday he started feeling bad. And then after a couple days, he got tested, and lo and behold, he tested positive. So I had to start working from home and seeing the patients via telehealth. And, for the first week, I was like, well, this is easy. My wife got it. She did very well, felt feverish for a couple days. My daughter ended up getting it, and she lost a taste of smell and taste for a couple days. Big deal. My son-in-law got it, and he felt really bad. For about 2 days, he could hardly stand up. And then this cough just started getting worse and worse. Eventually, I got coughing so much, I was drinking hot tea all the time, and honey, and cough drops, and cough medicine. Eventually, to the point that it actually started to hurt if I took a big breath. And I had a pulse ox with me, and I could tell one day I was doing particularly poorly, and I had an albuterol machine, and eventually I couldn't keep my oxygen level up. I was taking nebulizer treatment every hour to the point I was shaky, and fortunately I had a pulse ox with me. My concern would be if I didn't have had that pulse ox with me, I would have been like, I just need to be tougher. Steve, you're being a wimp. You just need to be tougher. But when I saw my oxygen level was dropping, I realized it wasn't just me being a wimp. I'm perfectly capable of being a wimp, but it wasn't that not going on. That was not happening at this point in time. And so I had to wake poor Melanie up and tell her we're going to the hospital. Started packing up some stuff, and ended up going to the hospital. They took a blood gas, which is where they take blood out of your arteries. It hurts a little bit, but it gives more information. When they got those results back, Mark said it hurts a lot bit. When they got those results back, they said, you're going to be here, and you're going to be here for a couple of days. Some of these numbers aren't going to mean much to everybody, but at one point in time, my PO2 dropped down to 58. That means something to some people who are listening to this podcast. Doesn't mean anything to most. But that means that they're going to either start blasting me with oxygen, or I'm going to end up on a vent. So they started giving me some of the antiviral medication through an IV. They put me on a unit where they were measuring my oxygen and my heart rate constantly. They gave me something called high flow oxygen, where they take these, you all know what an oxygen cannula is. Well, this one is thicker and goes in a little bit tighter. And man, they blast you with oxygen. It was so much oxygen, making so much noise, I couldn't hear TV or anything else as I was stuck there. Wasn't the most enjoyable experience, but it worked. I was in a hospital for a total of 6 days. I got out of the hospital. I will throw this little thing out for my wife, Melanie. Melanie was not able to see me the entire time. When I finally got out of the hospital and I saw Melanie, I immediately felt some better. And that's actually true. Went back home. If I took the oxygen, I had to wear oxygen all the time. If I took the oxygen off, I immediately started to desat. Desat. So I went to doctor talk there. My oxygen level immediately started to go down, and I was expecting I was going to be on oxygen for about a month or so. But every day, once I got back home, I started to feel much better for about a week. And then the improvement was much less quick, but it didn't have to be that quick. I was off the oxygen. I could see patients again from my home through the computer system. They were in the office, but come lunchtime, I was back in bed.
Yeah.
And then finally, I got to come to the office, I think about a month after I first started. I can't remember the exact time frame. I bet Denise would, but I couldn't remember the exact time frame. But even then, after I saw my morning patients and all, I went home and I went to bed. But now I'm pretty much back to normal. I can see patients. I notice it is afternoon. I'm still at the office. I'm not home in bed. So I'm pretty much back to normal. I can get in a treadmill and I can work out. Now I can be a little bit sensitive to oxygen in cold weather in the first place. It can make me cough like a lot of folks, but I still don't like breathing in cold air.
Yeah.
Last night, looking at the Christmas star, no physical activity, but I could feel that shortness of breath coming in my chest.
Oh, wow.
However, if I go on the treadmill, I'm fine. It's not the cold air. So that's my version of it. Obviously, most patients do not do as badly as me. I can joke around with some of my patients now, say, "Hey, you did way better than I did," or offer maybe a little bit of encouragement that way. But it was an interesting time.
Wow. And I guess a lot of people don't know you, Dr. Smith. So for him to be down and not able to move is That's an anomaly because he's always going. I think the Energizer Bunny copied him. Don't you think, Rick?
Yeah.
Yeah, so because he's always going, he's 100 miles per hour. He's doing things, he's nothing stops him. Even a parking lot won't stop him because when he's driving, he don't stop. I'm just playing that.
Unfortunately, Daniel's not just playing; he's seen my driving. But yeah, I go most years not using any sick days. And I have no underlying conditions. I have very mild hypertension, which wouldn't qualify as an underlying condition for this. But it's a funny thing. It's really hard to predict how it's going to do
It is.
In different people.
It is. And I guess that's what makes it so scary, Dr. Smith, because we can be side by side and both of us contract the same disease and the same virus. And I have no symptoms. Nothing happens. And then it does you the way it do you. And so it's kind of confusing, how that works, where I might have underlying conditions and you have none. And then you're more affected than I am. But then another situation is reversed. And so we're still learning about this, about this virus. And I know you're going to tell us some ways to prevent it and some ways to some things that just came out, some innovative ways that we can deal with this. So we're going to let you go ahead and handle that.
Okay, I sure will. But what you said is weird. It's a weird virus. If you give me a patient, I will talk with them, and within 5 minutes, I will be able to tell you whether they have the flu or not. Right. The CDC recommends we don't even bother with those flu swabs. The history is that accurate.
Right.
And but in this one, it can be a headache. It can be an upset stomach. It can be heartburn. That loss of sense of smell and taste, that's actually from the brain. A lot of people get because you have a lot of stuff in your sinuses. No, this is a loss of taste and smell from the brain. Insomnia, again, not from being uncomfortable, central nervous system. Fever, but really bad reflux, aches, cough, shortness of breath. But this time of year, who's not coughing? Right. So it is a really hard thing to diagnose from a doctor standpoint compared to other things. But hopefully within several months, we won't have to worry about it as much. That's my little intro to the vaccine. So do you want me to just talk about the vaccine, or how do you want me to do this?
Yeah. Go ahead and knock it in.
Go ahead and give it a shot. Go ahead and give it a shot.
Yeah.
Oh my goodness. Okay.
But if I could, before you do that, I want to chime in just a second. But what Daniel and what you were saying about the symptoms are totally different. I mean, early on, I rarely had symptoms. My wife did. She had some prior to that. But throughout the whole thing, I think for me, it was the sense of the unknown, especially with me having underlying conditions. I was freaking out, worried. I try to be a rock for my wife, but I was worried because of the lung condition that I have. And but I'm fine. It worked out for the best. So I got it. It's just weird. Weird.
Well, we do have the vaccine. There are a couple of vaccines out, as a matter of fact. Ours is the Moderna. Ours is the one that doesn't have to be stored at temperatures that you only find in the Antarctic, and doesn't need to be served on dry ice. It is not a live virus. Okay. So it's not the type of thing that, if I take this, it might give me the COVID. No. That is simply not possible. You cannot get COVID from this virus. Simply impossible. From the vaccine, it's simply impossible. And the other thing is, does it work? A flu vaccine, about 60% effective. That's better than nothing. 60% is better than 50%.
Yeah.
But this one kicks in at about 95%. I mean, it is thoroughly effective. Yeah. If you're CareSouth, how's it going to happen? They're going to get your name, and the medicine will be delivered to the sites by DHEC. And we'll go ahead and get those vaccines done. At MUSC, they had the doctors do it first in order to show leadership, and then once the doctors had it, then the rest of the staff would feel less nervous. And then they gave it to, I think, the nurses the next day or the day after that. And then all the rest of the staff. Of course, it's also going to the nursing homes. My nursing home gets theirs January 5th.
Wow.
Good.
And then they'll get, January 12th, and then they get the second dose January 5th. And it is 2 doses.
Right.
And you do get some of the immunity after the first vaccine, but you don't get it anywhere near to the 95% until about 2 weeks after the second vaccine.
Gotcha.
The other thing is asked a lot, is it safe? Is my arm going to fall off? What's going to happen if I get this? It is safe. One of the concerns that people have is, well, it was a rush job. Everyone was in such a hurry to get it out. Are you sure it's okay? And although there certainly was a rush because so many people are dying from it, particularly elderly, or if not dying, ended up like me in the hospital, and our hospitals are getting full, even in our little area where we are having hospitals that are full and no longer accepting new patients. A lot of the way this was sped up was that while they were doing the research, they were also producing the vaccine. So that as soon as it was approved, there were already millions of doses of the vaccine ready to hand out. And the government had said, look, if we end up saying that yours isn't okay, you'll be reimbursed. So go ahead and invest the money and produce this stuff so that we're not going to be spending months after we show that it's effective putting it out. So it is safe. And that's something that everybody agrees on. That's something that, is not controversial. I appreciated the fact that Vice President Pence got it. President-elect Biden got it. This is something that red and blue can agree on.
Right.
This virus is safe. Something just popped up on my computer. I don't know if you can see it or not, but there it goes. And can it cause side effects? Well, yeah, it can. And side effects are along the same lines of a flu shot. It can cause some achiness. It can cause some fatigue. It can cause some headaches. Our version of it less likely to cause headaches than the other version of it. But they are mild. What about if you're allergic to it? Because, some people have heard on TV that, 2 people in England and 1 person in Alaska were allergic to it. Actually, they weren't allergic to the vaccine. They were allergic to the stuff that was in the shot that wasn't part of the vaccine, some of the stuff that they used to make it a shot. And so they came out and said, okay, if you have had severe allergic reactions, and by severe, they mean shortness of breath, to injectables, other vaccines, then talk with your doctor first. But again, if all these people who've gotten it already, that's it. That's a really low number. There was one, I find this funny. You may not find it funny. I find it funny. They were giving it on TV in Ohio as other places, so you can see the staff do it. And they made the mistake of picking a nurse who had a history of fainting.
Yeah.
And in front of all of the cameras, which you'd be nervous. If I get nervous doing this, I can only imagine being on TV. She gets a shot, and the poor nurse faints. And I know that must have been so embarrassing. But that was a faint from being nervous and getting a shot that had nothing to do with an allergy to the virus. So it is indeed very safe, and it is effective. Now, next thing people will say, well, is there anyone who should not get it? And the CDC has been vague on this. Now, the reason they've been vague on this is they don't want to say things they're just not 100% sure of. Pregnant women. Of the pregnant women who have gotten it, they've all done well. So they say pregnant women can get the vaccine. Notice they didn't say should or have to. On the other hand, well, what if you get the virus while you're pregnant? Well, we have a huge study from New York that shows your baby's going to be okay. So it's not like you need to rush to get it in order to protect your baby, like you might from the mumps or something or whooping cough. So, they left that one kind of vague. And so it's just something that, to talk with your doctor about. The other one that they left a little vague was, what about if you've already had it? So the question then becomes, can you get it again? And the answer, I'm going to quote the CDC, is yes, but it is rare to be reinfected.
Right.
And if you were to look at the article, some of you be familiar with Lancet, some of you wouldn't. They use the term reinfections is extremely rare.
Right.
We have one confirmed case in America from Nevada.
Mm-hmm.
So can it happen? Yes, it can happen. But is it likely to happen? No. So again, they'll say that, if you get the vaccine, it will boost your immunity even more. Do you need even more immunity? Maybe not. So, they leave that vague. So those would be the two. And of course, the people who they push also kids. In fact, I don't think it was even studied in kids under 16 years old. Is the elderly and healthcare workers. And of course, we all know a lot of healthcare workers.
Yeah, yes, sir.
And I was a little surprised that the nursing homes aren't requiring it. In the nursing homes, you are required to get the flu shot. You don't want a flu shot, you don't get a job.
Mm-hmm.
And the flu does not hit our nursing homes nearly as bad as this does. Now, I'll tell you something. I really enjoy nursing home practice. While I was sick, more of my personal patients in the nursing home died by far than any other time frame. And the nursing home chose not to tell me about it because I was out sick. And I understand that, and I appreciate that. But I come back to work, and I drive up to the nursing home, and I walk into medical records first thing, and I had a surprise waiting for me. And I had to leave the nursing home and sit in my car for a while. So honestly, I feel sure that I feel confident, but pretty much everyone who works in the nursing home, unless again they've already had it, or maybe if they're pregnant, are going to go ahead and get it because they've seen what it can do. But that means a vast majority of adults, and that is why they are pouring this stuff out. And that is why you're seeing the national leaders go and getting it in public and talking it up and talking about how important it is. So that's most of my spiel. Now, I'm going to answer a couple questions if you have any, or at least try to. And then I do have a little bit of a closing I want to give.
Okay. I know one question, Doc, was who should not take it out. I know you mentioned about pregnant women, but is there any other?
Again, I'm going to say I shouldn't say pregnant women shouldn't get it, because that recommendation may change very, very narrowly. They can get it, but they should talk with their doctor about whether it's really needed or in their best interest.
Okay.
So the only people who shouldn't get it is if they've had a severe allergic reaction to another vaccine, or, as I understand it, unless it's changed, and they might, those under 16. Those are the folks who clearly should not get it.
Okay. Okay. There's another one. Someone said that they heard on television that the Madura had something built into it. If you got COVID, you weren't contagious.
I think I understand what they're saying. I think what they're saying is, okay, once I get this, if I come down with the COVID anyway, if I'm in that 5% that it's not effective, can I spread it anyway? And the answer is they don't think so, but it's going to take more time to know. But the emphasis there is, and I know a lot of people aren't super into math, but remember, 95% is an A in high school. Remember that you were thrilled with 95%. Okay,
I take it all day.
yeah, and so the odds of you coming down with the virus to begin with, much less be able to spread it, are down dramatically. Joy Gandy, if I ask a wonderful question. If I've already had it, should I get it again? And I'm going to make that question more complicated than I wish I had to. And it comes with this question: are you sure you really had it? Okay. Now, if you tested positive and you had symptoms, the likelihood that was a false positive is very, very small, because you got the positive test and you got the symptoms, and the likelihood of that is. But if you tested positive and you had no symptoms, odds are you had it. Odds are the test was correct, but the odds aren't overwhelming. It's more like 80%. Again, 80% is not bad. So, some people are saying, well, if you had tested positive but you're really not confident, to go ahead and get the antibody test done. And that's, I think, very reasonable. Again, some of the stuff haven't been played out. Personally, and I do, that I definitely had it. I got a CAT scan showing it all through my lungs, and I had COVID pneumonia. The likelihood of me being the second confirmed case in America is so remote that I don't think it's worthwhile. So if you are sure that you had it, personally, I would not recommend it. Now, I may end up getting it anyway, in order just to show leadership or something like that, but it will be purely political.
Yeah.
If I do it. It won't be because I feel like I need it. It's just that I feel that other people, political.
Yeah.
I saw the question: long-term side effects. None that we know of.
Right.
And it's been given already to a lot of folks, but there are none that we know of. In fact, there aren't much in terms of short-term side effects or medium-term side effects. And there are other versions of the vaccine out there that have been out for months, but used in other countries.
Mm-hmm.
And so we could have been doing this 4 months earlier, as Russia has, as many other countries have. But we chose to wait until we could clearly say, y'all, this is safe.
Right. Absolutely. I do have another question that came in via my text. They asked if you could talk about the mutated virus that we're hearing.
Oh, yeah. Hey, that's a great question. In fact, I probably should have brought that up.
Yeah.
Hey, this virus changes some. Does that mean that this vaccine will not work on version A, B, or C? The genetic part that this virus targets is part of all of the strands. So the CDC has said, we are confident that it covers all of the strands that exist to this point in time. So that's a great question. Yes, it will cover it, even though some of the viruses are slightly different than some of the others. It will cover all of our COVID-19. I'm sure glad that person asked that question.
So, Dr. Smith, correct me if I'm wrong. The mutated strand doesn't cause any worse symptoms. It's just more infectious. Am I right?
You are correct. It doesn't make you sicker, but it can spread even faster than the baseline. but the vaccine will work for both, just as well for both.
Okay. There's another. Would you recommend getting tested first before getting the vaccine to make sure you're not currently positive?
No, not unless you're sick.
Oh.
Not unless you're sick.
Okay.
If you're running a fever, then absolutely, but not unless you're sick. Well, I've already been on here for 30 minutes. I can't believe that.
Yeah.
It has this little red thing on the top left corner. But I want to make a little bit of a pitch.
Yes,
okay?
Sir.
As you two know, but not most of the people watching this, doing something like this isn't something that I look forward to. Something like this makes me nervous for a couple days ahead of time.
Oh.
And it's not something I enjoy doing. And you know, I volunteered to do this because I have fairly strong views on it. Why do I have fairly strong views on it? Because you've had it? No. Because I am so tired of this virus. I am so done with this. I want this gone. And this is how it gets gone. And why do I want? Okay, first off, because I don't like seeing people sick. I am not saying that if the person watching this gets it, they're going to come down as sick as I was. And I don't want to scare people, because odds are they won't come down as sick as I did. They won't end up in the hospital with, but they might. So, I mean, there is that aspect of it. Another aspect of it is our community needs to get past this. I was so sad to hear, Bizzle's closed in Hartsville. They're selling the equipment, I understand. The grandmoms need to be able to come out of their homes now.
Yes.
What a lot of people do not appreciate is the mental toll this takes on people who are staying locked up, because they feel, for many of them, they didn't like going out that much to begin with. And now it becomes more nervous, more awkward. And a certain percent of them are going to continue even after this is gone. We call that agoraphobia.
Right.
As Daniel can go into great detail with, it's hit the mental health very badly.
Yes.
Huge increases in suicides and opioid overdoses.
Yes, sir.
Increases with depression, increases in filings for divorce. Apparently, both people staying at home full time is not good for the marriage.
That's right.
I heard this spoken as a positive. Well, the states were losing money with taxes because of businesses going under, but they were making more money because people were drinking so much more alcohol. There was more revenue from the ABC stores.
No.
Okay. More revenue from the ABC stores is a bad thing.
Bad thing.
Okay?
Yes,
Increase in alcohol is a bad thing. Okay. So it is taking a mental health toll. Here at CareSouth, someone's child's exposed. Well, then the employee's out. Well, then the next employee's out. And we're having to wear these stupid masks all the time. The patients can't see us smile at them or offer encouragement. Our poor employees having to go and eat lunch in the car in order to avoid sharing their virus. I am so tired of this virus. And it continues until there's herd immunity, and the herd immunity is going to come from the virus. We don't want it to come from so many people being sick that the hospitals are full. I mean, this is the preferred way to get it. So I am looking forward to the population and to our and to the employees getting this done so we can put an end to this and come back to whatever normal is, where we don't have to do this. And like I said, I was encouraged to see President-elect Biden do it, Pence do it. I was joking. Actually, I wasn't joking earlier. Red and blue doesn't agree on anything. Well, this is one thing. That the red and blue leadership, Republicans and Democrats, we have got to get victory over this virus.
Yes.
And this is how we do it. We have got to end these shutdowns and this horrible attempt at education. As Daniel's shaking his head. True story. I have a patient comes in. Their 9-year-old is with them with their computer. Their 9-year-old's at school.
Oh, wow.
Mom is in the office with me crying over her depression. In the same room, the 9-year-old is trying to do school on his computer. How much school? It was a she. How much schooling do you think she was really learning?
Not much.
You know, so like I said, I just really want to make a strong pitch. Let's get this virus and let's end this thing.
Yes.
Is there a timetable for the employees of CareSouth that are out there listening? Is there a timetable when we can expect to be the vaccine be available for staff?
I think it's going to be within a week before or after New Year's Day.
Gotcha.
So just around the corner.
Gotcha.
MUSC's already gotten theirs.
Right. Look forward to it too. Yeah, looking forward to it.
Okay. Well, hey, I didn't, for all those watching, I'm sorry I went on for 36 minutes. I did not realize. If someone said, what if you have a history of having allergic reactions to other vaccines? If that allergic reaction was a severe allergic reaction causing shortness of breath, the answer is no. If that allergic reaction was you had a red spot where they gave you the shot or some swelling in the arm, yes, you should.
Right. Wow. That's some great information, Doc.
Really good.
Okay. Thank you.
Yeah, we definitely appreciate you coming on.
Okay. You all have a wonderful day.
Well, it's good seeing you, Dr. Smith. Really good seeing you.
Good seeing y'all too.
Yeah.
You have a wonderful day, wonderful weekend, and have a Merry Christmas.
And Merry Christmas.
Merry
All right.
Christmas.
All right, that was great. That was great.
Yeah. So Rick, so while we're still live, you want to go ahead and tell everybody where they can tune in?
Yeah, absolutely. So you can view this podcast on our Facebook page. You can also search us on YouTube, CareSouth Carolina Community Live Podcast. You want more information about CareSouth Carolina and Dr. Smith and any of our providers, our services, our programs, you can reach us at www.caresouth-carolina.com. You can also give us a call toll free at 866-498-0399, or just leave us a message on our Facebook page, and someone will definitely reach out to you and return that message. So there's some great information. We appreciate everyone for tuning in today. We want to just do our part as an organization, CareSouth Carolina, and both me and Daniel to have certain guests on here to make sure you get the information that you need, so you can make an informed decision on your healthcare needs, whether it's COVID, whether it's diabetes, whether it's this vaccine, no matter what it is. We want to use our platform and for that purpose. What you think, Dan?
That's what I believe. The first step to alleviating any pandemic, epidemic, or any community issue is education.
Yeah. So
the more we know, the more we can do, the more we understand, and we can make educated decisions about our health. Like I said before, and I stole this saying from the Lazarus Project, every community is responsible for its own health. Okay. Yeah. And then on top of that, every overdose that we've been seeing during this time has been preventable. So we need to get educated on what we're doing so we can end this pandemic, so that we can end all this isolation and physical distancing and in some cases social distancing, so that we can get back to a somewhat normal way of life and we can enjoy one another's companies, and we don't have to do so many virtual hugs, but we can actually do some physical hugs and some physical touching. It's part of human nature that we crave human touch. Yeah. And when that's lacking, there's a whole part of us that's missing. So let's do what we're supposed to do as far as this vaccine. We're not forcing anybody to do anything, but make an educated decision and stop listening to the naysayers with all these conspiracy theories about everything else. As as the your lady said before, that came and talked to us about it, sister epidemiologist for the state of South Carolina, and she said, if it can't be proven through research, then don't buy into it.
Yes.
So people tell us stuff, that there's robots in the vaccine, that there is that this is the mark of the beast, that that this is part of the genocide, that they're going to kill off so many people so that we can have enough food to eat. Stop listening to all that. This vaccine is solely for the purpose of ending this pandemic. That's it. It's for that purpose, so that we can get healthy as a country, as a nation, as the world. We can get country again. I mean, we can get healthy again. We can get well. So, but yeah, I said all that to say this: make an educated decision. Stop listening to everybody and find information for yourself. I hate to say this, Marek, but I have to say this, okay?
Yeah.
Because I am a preacher. But even the good book tells us that we have to study to show ourselves approved. A workman need not be ashamed of rightfully dividing the word of truth. So which means we have to study for our own self, and we have to research and make sure that we know what we're talking about when we're talking.
Yes.
And most people that tell you this, they have no degrees in healthcare. Okay, so don't listen to them. Read the books. Read the books. I'm on my soul.
Yeah, I got you. And when we started this podcast, we made the promise, and we will make it again, that we're going to bring you all the information you need, so you can make an informed decision about your health. That's our goal, and that's what we're going to do. And this may be the last broadcast before the Christmas holiday. We don't know about next week. We'll have that discussion in a little bit. But if it is, definitely before Christmas, have a Merry Christmas. Enjoy yourself. Be safe, right? Be safe and enjoy yourself. And maybe we'll see you next week. If not, we'll see you the first of the year, right?
That's right.
In 2021, where we hope 2021 is going to be the year that we take on this pandemic and this virus, and we're going to win.
That's right. Mask up.
All right.